A survey carried out by the Uganda Bureau of Statistics in 2010 revealed that households in Uganda spend over 350 billion shillings purchasing tobacco products. While the initial trend was that the adults smoked more than the youth, there has been a shift. Between 2001 and 2011, smoking among adult males reduced from 23 to 15% and grew among male youth from 12 to 15%. Among girls, the shift was from 11 to 15%. Dr. Mujenyi, the manager for Center for Tobacco Control, puts the blame on advertising.
The industry specifically makes promotions to attract the youth, and they know the youth are people who want to adventure.
Which means that in the future, you have more people who are affected by the diseases associated with tobacco.
Our audience is not the young people. We are very, very, very serious about that.
Besides that, this shift in trends is said to be a result of the consistent pricing of the cigarettes. For the last 5 years, research has shown that the price of cigarettes has seen little or no change, despite inflation and other factors that have caused other industries to reprice their products. Smoking has also become trendy, and youth are big on trends. They will adopt what will make them identify with their peers, even if it threatens their health.
Scientifically, tobacco has no value to our existence. It has no value to our bodies.
So we believe that we'd rather provide a product that is, well researched, very good quality, and things like that to these people who have chosen to smoke. However, we are actually very open, and we do not go out promoting the smoking to people.
The effects of tobacco are numerous and have been spoken of countless times. What now stands out is a study showing a linkage between HIV/AIDS and the use of tobacco.
People who have HIV/AIDS and they are smoking are likely to die of smoking more than they are likely to die of the infection itself. And it's because the nicotine affects the whole body, and the components of the tobacco affect the use of the ARVs.
Other known effects of tobacco use include lung cancer, heart problems, chronic cough, diabetes, miscarriages, and impotence. If you have tuberculosis and you are a smoker, you have twice the risk of dying than another who does not smoke. Second-hand exposure, and particularly fetal exposure to maternal smoking during pregnancy, significantly increases the risk of childhood invasive meningococcal disease. Mothers who smoke are also more likely to produce low birth weight babies. While the tobacco industry maintains that it is doing its responsibility, warning the public on the effects, others believe that this is not enough. They want the bill on tobacco control passed into law and fast.
So tobacco, unlike other public health problems, it cannot be managed by public education alone.
The bill is seeking to draw lines on taxes, on where you can smoke and cannot smoke, on what the responsibilities of individual organizations and businesses are going to be. If you go to Kenya, for instance, all tobacco products have very clear, bold warnings for everybody to see and know what they are getting into, and we want that to happen.
We believe that at the moment, as per the Ugandan standards, the Uganda National Bureau of Standards directs us on the size of health warnings that we put, and the current health warnings are at 30% of the principal display area of a cigarette pack, and these have only been in place for about 2 years. So in terms of implications, previously were 10%. In terms of implications, we believe that the warning, the message is passed out there, and looking at other markets or other countries that have attempted to even go plain packaging. If you look at the Australian case, I don't think people have stopped smoking.
The person who is smoking will not be affected by may not be so much affected by the packets which are there. But when you take your packet and you put it in your sitting room, your young daughter sees it, your young daughter will not like it. So he will feel disgust about the likely consequences of the smoking effect, of the smoking lifestyle. So the packets are meant to discourage the youth.
Players in the industry, however, are not comfortable with this bill in its current state. They feel it is out to totally destroy the industry.
Yeah? And we've seen countries like Canada, where there is very strict regulation, and if you look at the level of illicit, it goes up. The level of children smoking is even higher. We believe that there should be comprehensive consultation of different stakeholders, sitting in a room as anti-tobacco lobbyists and coming up with a law that should be enforced by us on this side is maybe a little bit unfair or unrealistic.
And the bill is made on the basis of the WHO FCTC treaty. The industry, according to that treaty, is not entitled to have their views in there because the bill is meant to regulate them.
There is also the aspect of taxation.
While you will increase taxes and say punish the industry, will pay more, maybe our sales will go down or whatever it does, the reality is that we both lose. The profitability of the industry is impacted, but the government will also lose. If a lot of the money is going to illicit, then we both lose.
There have been complaints as well that the statistics on the diseases that result from tobacco fed to the public are not representative of the scenario in Uganda, that most research is done in more developed countries and therefore does not apply to the case of Uganda.
Diseases do not know color, they do not know tribes, they do not know borders. If there is research in Australia that mosquito bite causes malaria, even if you don't repeat the study here, you know that that evidence is, because science is universal.
Tobacco is largely grown in the West Nile and Bunyoro regions. Josephine Karunji Musisi, NTV.